My name is MCKENNA Dailey, and I am doing my benchmark assignment on knee valgus. So basically what knee valgus is just the knees caving inward, as you can see in this video here. One overactive muscle is going to be the hip adductor complex, which basically pulls the thighs inward as well as the knee because they're so tight. And then one underactive muscle is going to be the gluteus medius, which helps stabilize the hips and knees. So when it's underactive, it's taking away from that stabilization. Okay, so the first phase of our exercise continuum is going to be the inhibitory phase, which is basically just to reduce the activity of the nervous system. So foam rolling is going to be one of those things that you can do. So here in this video, I am going to foam roll my adductors, so the inner thighs, for about 30 to 90 seconds in one spot on each leg. I'm going to just perform one set on each leg, that is it, but this is something that I can do every single day. A regression of this foam rolling is going to be to focus on a little bit less sensitive areas, so moving it around, seeing what feels better, what feels worse. A progression is going to be just applying a little bit more pressure, so really honing in on that sensitive area. And then some contradictions include osteoporosis, arthritis, healing wounds, and is not limited to, but those are the main ones. So yeah. All right, so hopping in to the second phase of the exercise continuum, it's going to be the lengthening phase, which is basically just increasing extensibility of the muscles that have been previously shortened. So in this video, I'm performing a frog stretch. This is something that you can, again, do every single day for about 20 to 30 second hold, anywhere from 1 to 4 sets. The regression and the progression is just going to be to adjust the distance between the knees. So bringing them a little bit closer is just going to make it a little bit easier. Further apart is going to get a little bit more of that stretch. Some precautions and contradictions include the special populations, neuromuscular disorders, seniors, osteoporosis, and so many more. So now I am hopping into some side cable kicks, which is going to focus on the third phase of the exercise continuum, which is the isolation phase, which basically means it's just isolating very specific muscles. So here we are isolating the gluteus medius. So with these cable kickbacks, this is going to be something you do anywhere from 3 to 5 days per week, 1 to 2 sets with 10 to 15 reps per set. And then the one thing that we really want to focus on, as you can see in this video, is that 2-second isometric hold. So 1, 2 there, and then a 4-second on the eccentric. So we'll watch right here. Hold and 4 seconds all the way back down. That's something that we really want to focus on in this. This is just the other side. So a regression is just going to be able to take the cable away. So we're just basically doing that body weight, if you will. And then a progression is just going to be to focus more on that hold, as well as just increasing weight, so adding a little bit more tension. And then again, precautions and contradictions include special populations, neuromuscular disorders, and impaired joint motion, as well as there are others. I just did not list every single one of them. Again, the biggest thing that I want to point out during this phase is just that 2-second isometric hold and that 4-second eccentric all the way down. It's super important when we're isolating that one muscle, and we're isolating that underactive muscle, which does affect knee valgus. So yeah, the video will pop up soon, but we're just going to hop into the fourth phase, which is the integrated phase, which basically means that we are introducing all of the muscles that are working together. So here I'm performing a banded lateral walk. This is something you're going to want to perform anywhere from 3 to 5 days per week, 1 to 3 sets with 10 to 15 reps per set. We are focused on slow and controlled tempo, and then the regression and the progression is just going to be adjusting the resistance of that band. Cautions and contradictions include special populations and the position of the exercise, etc.